Hello. We are live. Okay. Hi everyone. It's another Saturday, 11:30 by my watch. Yep, 11:31. So I'm here again to let's see who's on. Here again to have our weekly conversations about your gynecologic health and obstetric health, but we are in the series about sexual health now. So I'm going to give a few minutes for a few people to join so that we can go ahead and continue this discussion. I know this says that we have a few people online already, so I see you. I can't see names yet. Let's see. If you're just joining, go ahead and you know the routine. Just put a hi or a hello in the chat box so that I know that you're here. And then if you're watching this on replay, if you just type in hashtag replay, that way I can always come back and acknowledge you. So, yeah, this says we have a couple of people on here. Folks are going to be a little shy today, I guess. Okay, so just a recap. What we've been doing again, or what I've been doing, is coming to you every Saturday at 11:30 to initially talk about alternating obstetrics and gynecologic topics. And then in the past 3 weeks, because I skipped a week, we have talked about sexual health. We did a general overview about it, and then I had to work 1 week, so I missed you guys. And last week we talked about sexual health as it relates to adolescents and our moms, our postpartum patients. Today, as per your request, we're going to discuss orgasms a little bit. And I like for you to put questions in the text boxes so that I know that I'm hitting on the specific questions or myths that you may have heard over the years about these and trying to dispel them. So, all right, the numbers are going up a bit there. So, all right, we'll go ahead and get started. So, I'm Dr. Vanga, your board certified osteopathic OBGYN. I come to you to help dispel myths about your the female body, so that you can make your gynecologic decisions with more confidence and in that process find your voice. I encourage all women and men to listen in sometimes, because I think we can all get away with some information. So last week I did a recap of the anatomy of the vagina. We talked about sexual health not just being related to intercourse, but it being a general term to define our thoughts, our emotions, what the term sex elicits for us when we hear it, because those all have to do with our cultural norms, they have to do with our religious norms and all of that as well. When we did the overview of the vagina, I promised that I would post a picture of it for you. So I have done that. If you haven't gone back and looked at last week's lecture, if you go ahead and look on that, I do have a picture posted that has the different parts labeled. So if you have any questions about that, we can go over that again at another lecture, but I may make some references to some of the anatomy again today as we go along. So what is an orgasm? It seems pretty elusive to some people, and there's always a huge mystery about it for others. In my private practice, the questions I get about it range from people not being sure if they're having normal orgasms or if what they perceive to be orgasms actually count. Well, there's no clear definition about an orgasm. For some people, it is just a release. It's just an intense release. For others, it's like the peak of exhilaration for them. Others have just a sensation, like a tingling sort of head to toe sensation. Some people will squirt when they orgasm. Others will scream and yell and have, the whole body convulse. So everybody experiences orgasms differently. I think that's probably the biggest realization for some people when we talk about this. But it's not always the way it seems like it is on TV, just writhing and carrying on and whatnot. Some people experience that all the time, but not everybody does. And the part that I want to harp on, and I'll probably come back to this a lot of times, is not everybody has an orgasm every single time they have intercourse. And that's only a problem if it's a problem for you. Because some people actually get satisfaction from the act of it, the different phases of it, and not specifically just the orgasm aspect of it, or their partner's response to them as well. So, again, there's no clear definition of what an orgasm is because people experience it differently. And so, if you're not sure if what you feel is an orgasm, if you're hearing people tell you that you've not had an orgasm because you didn't squirt, you've not had an orgasm because you didn't scream or yell, that's not necessarily true. Not everybody experiences that way. So, first myth dispelled regarding that. So I made reference to the different phases. Typically, when it comes to intercourse, you have your excitement phase, and that could actually sometimes be referred to as the desire phase. And then you have your arousal phase or the plateau phase, and then I won't say typically, and then sometimes the orgasm phase, and then the resolution phase or the afterglow. And each of those phases is equally important. In the general overview, I think I spent a lot more time talking about the excitement and arousal phase, even though I didn't say so specifically, but you can always go back to that talk and kind of pick up some pointers from that in terms of some of the things that tend to hinder those phases. If you're stressed, if you have any medical issues, if you have any relationship issues, then sometimes the excitement and arousal phase can be affected by that. The orgasm phase can be affected by that as well, but most especially the communication phase. So, okay, let's go stepwise with this. We now know that not everybody experiences an orgasm the same way. I see people on here. For some reason, I'm not seeing chats pop up here. So I'll go back later and address anything that you're putting in there. But let me know if you can't hear me. Let me know if there's any areas that you want me to talk about in more depth as I'm doing them rather than come back to them. Okay. So, okay. I got distracted by the little thing there. All right. So we know the different phases of intercourse. We know that not everybody experiences orgasm the same way, and that's fine. There are different types of orgasms as well. So, some people will orgasm just with stimulation to the clitoris. And for a quick overview of the anatomy again, this was our practical diagram of the vagina. This is the vagina. You had your labia majora. On the inside, you had your labia minora. You had your vestibule at the top. You had your Skene's glands that are the little glands that can squirt sometimes from the top there. You had your clitoris right there near the vestibule. The clitoris is covered by a hood, and then just above that is the urethra. Then you had your vaginal vault, you had your perineum. So the clitoris, what I was referring to, is an area that has sometimes been referred to as the sexual enhancer. So this is an area that some people will experience orgasm from if there's attention paid to that area. Now, one of the myths about that area is that it's just that little area there. But anatomically, the clitoris actually extends way past that. That's just the external aspect of it. There's a whole internal aspect to it. And the posterior aspect of it actually even extends into the labia a little bit. So unfortunately, sometimes some people think that to try to stimulate that area, you just want to rub on that area. That can be quite uncomfortable for some women. That can, if you just immediately go to it. Sometimes you have to start stimulating it around the area first before you come right to it. Or even stimulating the labia can sometimes enhance the sensation at the clitoris. But some people will orgasm when there is adequate stimulation to the clitoris. Some people will orgasm through vaginal penetration. And that can be, of course, there's different positions and things like that that can enhance that. But vaginal penetration is typically what we generally think of when you just say sex, penis and vagina. There is an area that also is the topic of a lot of different myths, which is the G spot. So this is an area that is sort of on the inside of the vagina, around the anterior aspect. You probably go in about a third way. And there's a lot of debate about the G spot, whether it really exists or it doesn't. There's as many people who believe it exists as people who believe it doesn't. And some people who are able to find their spot and others who are not. But generally, to try to find that spot, if you kind of stroke the anterior part of the vagina, sort of from the posterior towards the front, somewhere around a third way inwards is where it would be if you have that. And for people who experience orgasm vaginally, sometimes stimulation of that area enhances it as well. There's also combo orgasms where some people will only experience an orgasm if there's both vaginal penetration as well as clitoral stimulation as well. And usually, if those two areas are stimulated at the same time, that's when they will experience that. There's also talk of a cervical orgasm. I think what people are talking about when they talk about a cervical orgasm is really just orgasm on deep penetration. So, deep as in, the cervix is I like to call that the neck of the uterus. So, and it sits at the top of the vagina. So if they're in positions where the cervix is stimulated as well, then they'll sometimes have orgasms through that. There's anal orgasms. I admit I don't know much about that. But that is definitely an area that some people will orgasm from stimulation too. Also stimulation of the perineal area, that area that I described between the vagina and the rectum. Some people will orgasm just from stimulation to that. So there's a lot of different ways that people can experience orgasms. And again, they can experience the orgasms in different levels of intensity. So, as you can tell, there's no one fit to anybody per se. Unfortunately, we start off with not really knowing our anatomy sometimes. And once we even figure out our anatomy, there's a lot of, like I referenced to before, there's a lot of myths that we have been inculcated with over the years based on our culture, based on our religion, based on our belief of what a woman, a girl, a proper, well-behaved person should do. Or you may have no inhibitions about that. And then you're a little more exploratory. But we all know that there are people that are judgmental about it. And I think this has hindered so many women from being able to fully have an awareness of what their body's physically capable of doing. Some of the ways that we can try to, for people that have, let's say they have issues with orgasms, there are several different problems that they could have. They either have never had one ever, or they have some that are just not intense. And again, I said everybody experiences it differently. So when I say not as intense, then for us, the OBGYNs, our job is to figure out, when you say less intense than what? Than what you see on TV, what you think you should be seeing, or less intense from an experience that you've had before. That's completely different. Sometimes you can experience them less frequently than you did before. And sometimes there's also pain that comes into play that affects how we experience orgasms. So I'm going to talk probably more about pain with intercourse, either on initial penetration or deep penetration, on next week's lecture. So I won't go too much into depth on that today. We'll focus more on other things that can affect that. So some people also take longer as time goes on to experience orgasms. When we try to delve into why some of these things are happening, one of the main things, obviously we're talking about this in a medical sense, one of the first things that we have to make sure that we eliminate is any organic causes to this. So is there anything structurally that's causing a problem with that? Are there any medical illnesses or medications that we're on that could be affecting this, affecting our experience of it? So I know I'm going to talk about diabetes again, but diabetes is one that does affect our libido. It does affect our nerves. And so it's one that's notorious for being a problem. But other things such as alcohol intake for people who smoke, not just cigarette smoking, but marijuana smoking, that can all affect our experiences as well. So once we can eliminate those kind of structural and medical and self-imposed things like the alcohol and the drugs, then we can delve more into more physical things that we can actually help with. Okay, so some of the solutions to some of the issues that we could have with experiencing orgasms. For a lot of women, it takes much longer than for men to make it through those phases, to make it through the desire, excitement, the arousal, and then orgasm phase. So statistically, it's something like a man can reach orgasm or ejaculate usually within like 7 seconds at the fastest. And some women need at least 20 minutes to be able to get to that point. So foreplay is probably one of the things that can help a lot with transitioning people through that phase. And foreplay can mean different things to different people. For some people, it's just mentally getting themselves into the mood, starting from that morning. Okay, tonight we're going to do this, and I'm going to start thinking about it and sort of prepping themselves mentally, or eliminating different stresses that could cause issues, babysitter for the kids, so you don't have to worry about the kids knocking on the door and whatnot. For others, it could be sexy lingerie or whatnot, or sending notes or texts to their partner during the course of the day. So, and then for others, it's the physical touch as well. So, foreplay means different things to different people. Generally, for most women, the amount of time that's spent before climaxing matters a lot. So, there's that. And then the reason why that matters is because the longer you spend in foreplay, typically there's a lot more lubrication. There is, those glands we talked about, the Bartholin's glands, the Skene's glands, they release lubrication. As you go through the arousal phase, there's increased engorgement to the genital area, so to the vaginal area for women, to the penis for men. We're focusing more on the vagina here. So the more engorged it is, sometimes the more sensitive it is, and it just helps to enhance the experience. Going back, I said Skene's gland, so let me go back to that. When I talked about how people experience orgasms differently, I think I mentioned some people might, I can't remember if I mentioned that some people might ejaculate as well. Women can ejaculate, well, maybe I shouldn't use the word ejaculate, but squirt as well when they orgasm sometimes. And that's actually coming from a mixture of the lubricated secretion from the Skene's glands, and sometimes the urethra sits right on top, so from the bladder basically, and it's a mix that comes out, and it can be either like clear or milky sometimes. And some people will come to me and say that they are worried because they feel like they leaked during intercourse. And when we talk about it further, we realize that they didn't actually leak as in urine, just urine, but it's actually a squirt. And for some people, this is characteristic for them all the time with intercourse. For other people, it's more random, and some people never experience that. Again, everybody's experience is different. Okay, so going back to some of the solutions for trying to enhance your chances of orgasming more frequently, we talk about foreplay. And another one would be just knowing the anatomy. You know, we talked about that last time. Knowing anatomically for both people involved what the organs are, what they're touching, what they're feeling, what they're poking at. Some people get stimulated, like I talked about the clitoris, for example, you know, knowing where the clitoral hood is, knowing where the G-spot is, knowing that the labia can also enhance stimulation, knowing that you don't just focus on the vagina, knowing that some people will be more stimulated with things like kissing, nuzzling on the neck, nibbling on the ear. All of those kind of enhance that. And in foreplay is when you're supposed to kind of bring all the senses to a head. So, okay, there's that. Then there is another thing that can help sometimes is contracting and releasing the muscles in the vaginal area sort of also helps to increase blood flow to the area and enhance sensitivity. And one good way of doing that is Kegels exercises. For those who've never heard of what a Kegels exercise is, it is a way to sort of strengthen the muscles in the vaginal area, so that, and that tends to pump, enhance the pumping flow of blood to the area, so it tends to make it more sensitive as well. To do a Kegels, you would basically just squeeze the muscles in the pelvic area, in the vaginal area, like you were trying to stop yourself from urinating. Hold it for about 10 seconds and then release. And little secret, I tell my patients all the time when I'm counseling them on doing Kegels for various different reasons, not just for this, but for various different reasons. Kegels are exercises you can really do anywhere with nobody really having to know that you're doing them. So every time you get to a stop sign, that's Kegel time. Every time you're in the line at the grocery store, that's Kegel time. It helps to be able, and you can get a little more creative with it and try to pinpoint certain particular areas that you will try to, I'm trying to figure out the words to say this. You can try to be a little more fine-tuned on your Kegels exercises. Instead of just contracting the whole pelvic floor, you can maybe try to focus just on one particular area if you find that gives you more of a sensation as well. Okay, and for those who have, I know last week when I talked about moms having episiotomies and things like that, these are people that sometimes will benefit from Kegels exercises simply because it tends to just strengthen the vaginal tissue as well. And for those who are not able to get much resolution with just doing Kegels on your own, you can ask your OBGYN about, their opinions about referring you out to a pelvic floor specialist. They're actually the same way we have physical therapists that help with, muscle wasting. We have pelvic floor therapists experience. Okay, let's see. We're still live, aren't we? That was odd. It lost signal there for a minute. Okay. Let's see. Okay. Are we still on? Okay, I see people on here. For some reason, the live is showing up differently for me today. So if I seem a little distracted, it's because the screen is looking a little different to me and I'm not seeing your comments at all. Typically I'll even see your names up there, but I'm not seeing it at all. So I hope this is actually going out to someone. If not, I'll go post the video and we can do a recap later. But I hope this is going on. I see some names when I post down on the participants, but I can't see any comments at all from anybody. So I feel like I'm talking to myself here when it looks like there are people on there. It says 12 at the top and then at the bottom, I'm not sure. Okay. All right, so another thing we can do to try to enhance is, we've talked about knowledge of your body. You can get more knowledge through reading books about anatomy, reading books that may help with your particular fears or concerns about sex, which could eventually lead to issues with orgasms. There are various positions that you can research that may help enhance your experience as well. Underlying all of this is good communication with your partner. If you're not communicating well with your partner, then it's hard to let them know what feels good to you, what does not feel good to you, how you're responding to whatever it is that they're doing. And when it comes to positions, this is another thing. Obviously, you would need to communicate well with your partner to be able to try out different positions without each other feeling self-conscious or anything like that about that. So we've all heard of the Kama Sutra and all the various positions in there. Not all of that is for everybody. Some people are very happy with the missionary position and they're able to have fulfilling intercourse with orgasm through vaginal penetration only. That's fine. Different strokes for different folks. So just reading and just being aware of some of the different options out there will sometimes help. Another thing to maybe consider is enhancements like things around the bedroom that you can use to sort of change anatomic positions, like pillows, wedges, things like that can sometimes help to either stimulate the clitoris a little more or stimulate the G-spot a little more or help with the deeper penetration. If you're one of those that orgasms with clitoral stimulation or deep penetration, some of those things would probably enhance that for you when that's not been working before. And then of course there is toys, and depending on your comfort level with that. A lot of times if I have somebody complaining to me about not being able to fully experience the full range of the potential from intercourse, especially when it comes to orgasm, one of the questions I'll ask is, do you masturbate? And if you do, are you able to orgasm from that? I think there was a question in one of the sessions before that asked about, and I told the person that I would get back to it when I talk about this lecture, why it is that some people are able to orgasm with masturbation and they're not with intercourse. It goes back to the communication. If you're able to masturbate, if you're able to orgasm with masturbation, then you should be able to orgasm when it comes to intercourse. It's just a matter of the same area that is able to stimulate you well enough to get there when you're on your own. You should be able to communicate that to your partner so that they're able to assist with that, or you can self-assist during the intercourse process to enhance their experience. Okay. When it comes to toys, there are, I'm talking anything from just lubrication, which some people have qualms about even using lubricants during intercourse. Like they see it as something less than the full experience they're supposed to have, when physiologically, if you're not making enough lubrication, then it does not enhance the process, especially in the arousal phase, to get you to orgasm. So everything from lubricants to as experimental as you want to be. You've got your vibrators, you've got your and both internal, external vibrators, and doing some research on some of these things to see what you're comfortable with. Next week when we talk about pain with intercourse, one of the areas that comes up frequently on vaginismus is vaginismus being a condition where there is pain on initial penetration, is use of dilators to try to decrease that. And I sometimes will get some people thinking, why are you prescribing dilators for me? It's not necessarily for the actual act of sex. It's just for you to not feel pain when anything comes near that area. So, okay. Let's see. So yes, self-exploration, either by yourself, or with your partner. So self-exploration with yourself, just so that you know what feels good, what doesn't feel good, how much pressure. Do you like your clitoris stroked in an up and down manner, in a circular manner? How much pressure do you want applied? All of those things. I mean, if you don't explore that by yourself or with your partner, then sometimes it's harder to be able to figure out what would enhance your experience as well. Let's see. There are two different types of, when it comes to the self-exploration, it's actually two areas that sex therapists will harp in on a lot, especially when it comes to couples. The physical touch, making sure that you can, they'll work with people through touch that starts off non-sensually. So for example, things like massage, although massage just implies sex to some people. We all know that you can get massage for physical reasons, not just sexual reasons. But yeah, just focusing on just non-sexual touch through things like massage, using oils and whatnot, and then eventually leading towards, okay, this really feels good, this seems to be getting me more aroused and whatnot, and eventually leading there. So that's called a sensate focused therapy that can help sometimes with enhancing orgasm. There's also a cognitive behavioral treatment that would kind of go through working through all your different qualms and your different myths and your different anxieties when it comes to experiencing orgasms. So let's see. Okay, we've talked about the different phases of sex. We've talked about the orgasm per se, the fact that people experience that differently. It can be just a general sensitivity for some people to, what we see on TV, the writhing and the moaning and the screaming and whatnot. It can be different things there. There are different types of orgasms. You can have orgasms just through clitoral stimulation, vaginal stimulation, combination of both, anal penetration, or deep penetration, or cervical. That's what some people refer to it as. And anatomically knowing what the vagina, what your vagina feels like to you, so that you can either help yourself or help your partner help you be able to orgasm. We've talked about some of the different problems that some people can have, be it medical issues, medications, be it not ever orgasming, the frequency of orgasms being less, the intensity being less, and some of the different solutions to that, foreplay, Kegels exercises, position changes, reading some more about different positions that you can try, using things like wedges or pillows or whatnot, just to tilt the pelvis up a little bit to help. Self-exploration, masturbation, or with self-exploration, we're talking about either masturbation or exploring with your partner. Toys, and using them either by yourself or with your partner. I think that kind of covers a lot of the ranges of it. The biggest myth I hear a lot has to do with the actual experience of the orgasm. And I hope if you walk away with anything today, it's the fact that it doesn't have to feel this way. It doesn't have to be the way you see it on TV. People experience it a lot of different ways. There's a whole range of emotions that go with it. And you don't have to orgasm every single time with intercourse for it to be fulfilling to you. If going through the act and not actually orgasming is fulfilling to you, then you don't have a problem. Only about 10% of women are able to orgasm easily and without much work towards it. So you are actually the norm for the most part. I'm trying to think. I'm really sorry that I can't see your text today. I can't see any text at all, so I don't know if you're posting questions in here. I will go back once I end this to see if there are any questions posed, and I'll answer them in the comments. I'm not sure what's going on. I was able to get my mic today, so I was very happy about that, but now my comments are not working on Facebook. So I apologize for that. I have been uploading all the videos to my YouTube as well. So I'm not sure if there's rumors about Facebook not being able to do these lives all the time. So at some point I may have to just do them on the YouTube. So for those of you who have not subscribed on there, I just uploaded them recently. So if you want to go ahead and find me on YouTube as well, so that you can subscribe on there and have access to all of these. Okay, and also remember to go back to last week's lecture to look at the picture that I posted of the vagina with all the parts labeled as well. And if you have any following questions, send them to me. Remember to type hashtag replay in the comments so that I can come back and acknowledge you. And if you have any other areas that you want me to make sure that I address next week on our live at the same time, 11:30, make sure you post those to me as well. So I'll go ahead and end now because, again, I can't see any comments. I'm not getting any feedback per se to know if you guys are okay with all this information or if you need more. So I'll go back and look at comments and address anything else on next week's live, okay? All right, so Dr. Banger, your board certified osteopathic OBGYN, coming to you to give you knowledge that to help to dispel the myths that you may have about the female body, so that you can make your GYN decisions with more confidence, and in that process help you find your voice. All right, you guys take care. Have a wonderful weekend. Bye.